So I'm here with two of my favorite people. It is Breast Cancer Awareness Month, and I thought of no one other than Miss Terry, who was actually my first patient November of 2022. So it's been almost 2 years. And so we're just going to talk about, your experience with, the diagnosis, the healthcare system, and, lifestyle, like the things that you're currently doing, right? So that you've been here with us for 2 years, looking as amazing as you are. So we can get right into it. I will say, basically, like, how did your journey start? I know you brought it to me in November of 2022.
Yes. So, my name is Tutu, and I just want to say, take a moment to tell you all that Dr. Isom has been so instrumental in our journey. When it happened, we had no idea. So Mom had just come back from Kenya. She was looking very sick. Mm-hmm. We had taken her to different doctors, and all we were getting was that it was COVID, and it was not making sense based on how her symptoms are presenting. And, so finally we turned to Dr. Isom. She had just opened her practice, thank God. And so we, she ordered all these tests, and she was just moving really fast. And I remember the day she called us into the office, and just the level of care and just the nature of the way she delivered this really hard news. It was such a difficult time receiving the news that it was cancer and it was stage 4. And she was like, don't you worry, we're going to, move into action. And when I say she moved right into action, it was not just traditional treatments that she offered to us. It was like a lot of alternate therapies that were presented to us at a time when we just didn't know where to even start. Like, it was just a really hard season. And, just like a recommendation to go to MD Anderson in Texas, and, it's the best cancer hospitals. We're like, we're going to do whatever it takes to make sure, Mom goes to the best hospital.
So let's talk about that for a minute. I remember we were on all an extreme, and we were basically saying, like, go to MD Anderson, right? You had family there, it makes sense. And then when you got there, kind of tell us how that experience went.
Yes. And so we just blind faith, we're like, okay, let's go to MD Anderson, not really knowing the logistics of what it takes to be and going to the best cancer hospital. And so getting there and being told, unfortunately, to see our breast cancer team is going to be a 6-month wait. Mm. And we didn't have 6 months, Mom was, she was pretty sick at the time. And it was a matter of doing whatever we could do to make sure that, she got seen, and Dr. Isom was able to even get on the call with their doctors, describe the severity of the issue to, in fact, to go in the emergency room. Like, that's, how sick Mom was at the time, and just being able to get Dr. Isom on the line with their doctors and then able to give the breadth of the situation. And just being able to, really just advocate for Mom and just let them know, hey, we are not taking no for an answer. This is Mama. Like, we're not going back with our treatments. And so for them to see the fight and, and obviously they're willing to help. They just, sometimes you do really have to push. You do. Yeah.
And so she is being admitted.
Yeah.
And that was what started the process for her, like, entering the program. So I know part of the process was, she went to the ER. They actually ended up admitting her because of you advocating for it. And how did that end up going?
So while we're there, they admit her to the office. Wait, what the aid transport?
When she first got there. So yeah, talk about your first.
Oh, okay.
That was what happened. So you get there, she gets admitted.
Yeah.
And once she got admitted, what was that like?
Yeah, so once we were admitted to MD Anderson, luckily, thank God, decided to move pretty fast, trying to find out what type is it, what stage are we really in. And so they're running all these different tests. But when it came time for typing it, they said it has to be an outpatient. And there's a long wait list for that. And so again, we really had to work with the doctor here, Dr. Isom, and doctors there to let them know, we don't even live there. So, we can't necessarily come back, slide in for another test. And so through all of that, they were able to do a test that they don't typically do in the hospital, but they were able to do it there to give us the exact type of cancer we were dealing with, which then helped us to start treatment almost right away, which was incredible.
And you started treatment at MD Anderson.
Yeah, so she started treatment right at MD Anderson, which was amazing. She saw the breast cancer team while she was there, admitted, and it was just amazing. Yeah.
Okay. And so, I know that you were concerned and you were worried, and you definitely advocated very well for her, during her stay at MD Anderson. But you also did some other things. So tell me about what your thought process was about. Obviously, you're scared. It's your mom. You want her to, live the healthiest life possible. What was going on in your mind at the time?
Of course. So I am a pharmacist, so I have an idea of how it all works, because yes, they are the best, or you're seeing some of the best doctors, but they do have a lot of other patients. And so you have to really be on top of what's happening. You have to always develop a relationship with these physicians because they are so busy. They have a lot of caseloads. There's so many people they're dealing with. They're doing the best they can, understanding they're doing the best they can, but things slip through the cracks. And so just being there to ask a lot of questions to make sure nothing was getting missed. Have they done this test and that test? And you'll be surprised. Most doctors are very receptive to that level of being questioned, not necessarily questioning, but that follow through or follow up, because they are human. They will sometimes miss a thing, and, it happens. Yeah. So, yeah.
So what made you then look into alternative?
So we offer, I'm a big believer in the naturopathic way of doing things. I was able to heal a lot of my own inflammation problems with just natural remedies. And so we started to research, what kind of diet is best for cancer? What, understanding that, okay, so sugar and, high carbs and all this stuff was, is cancer cells not this diet, right? And so how are we going to change her diet? How are we, what supplements can we add to really combat this from every angle, right? Traditional, non-traditional. We would consult with Dr. Isom. Luckily, one thing that we appreciate is that you do think outside the box. It's very rare. It's very special that a doctor is willing to look outside of traditional ways of doing things, right? Introduce us to an amazing organization that has been phenomenal, right, in our journey. But a lot of it was just, we were going to do whatever it takes to fight cancer. It was going to be, what do you call it, Mama? Gloves on, right?
Definitely. Yes. Because you're a fighter.
From every angle. Go at it.
If you know her beautiful story, you will know that Miss Terry is meant to be here. She's a fighter. She's a wonderful person. Yeah. True. So with that, give us a sense of what type of alternative things that, you've been doing over the past 2 years.
Big one, huge one was a diet change. And mom pretty much, she's every morning without fail, without me even being on her case, she makes this green smoothies, all these vegetables every single day without fail. And then just cutting out a lot of the sugars, especially processed sugar, anything processed, period. We had to take off the table. And she's a sweet tooth, so this was a big sacrifice. To not eat the cakes or the donuts and just be really focused on healing. And we also started to implement, with this Answer for Cancer organization that Dr. Nasia introduced us to. We were able to start her on infrared treatments, which have great research, oxygen therapy, the hyperbaric chamber. We did even just the consultation. I think at some point she was doing like therapy, just helping her with her energy and the thought process for this whole thing, because it is a very emotional journey. It takes a lot out of you. And on top of that, we started supplements and anti-inflammatory supplements like concentrated turmeric from a company that we found that has great research that is now even in the physician desk reference for just the amazing studies that have come out with inflammation and detox in the body. So she's on a detox. She's on anti-inflammatory. And then one other one is like a multivitamin, cellular absorbed, and just gets her energy. And she's like, she works out. Okay. I'm not even that consistent, but Mama is on it every day with her the weights. She's like, let's go. And so she has energy, and it's like, we're just, we're so grateful. Yeah.
How do you have that kind of
Yes. So
she's doing better than body.
Yes. So yeah.
You also came to me, if I recall, with some non-traditional medications, right?
Yeah.
Yeah.
And I was like, Dr. Isom, she might look into this. She does things non-traditionally. And so I was telling her, hey, look into this. What is, and it's this company called 3 International. And they just had this very incredible science behind things that we know they're all natural, like the turmeric and a big detox from a very natural standpoint that I noticed a big difference in my energy levels when I started taking this stuff. And which other one are you on? So the multivitamin that has been phenomenal for your energy. Yeah. B12 loaded in there. And then she does, she's in there with a lot of the stuff, right? Green teas, foliars, the sachets, they're right. So there's one, packet that is like a glutathione, orally taken, should be amazing for Mom. So, but just the combination of it has been amazing. Like her doctors even tell her, like, you are doing really well. So because they know chemo is really effective, but sometimes, with chemo things progress. But with Mom, it's been the other way. She's really, really shown positive, like drastic changes. And so her doctors are so impressed. We're happy. So it works, it does.
Yeah, so you have the supplements, you have the holistic kind of wellness thing, where there's meditation, and so forth. We added a few like actual traditional medication, or actually non-traditional for the as well. I remember you came to me with the research for that.
Yeah.
And I said, okay, well, let me look into it.
Yes. Yeah.
So they moved forward. So tell me like their experience with even going that route, because you do believe in the naturals. How did you then also decide that, this may be an additive?
Right. So I know there's some, it's controversial, but there's ones like it's ivermectin and mebendazole that has so much research with cancer cells. And so we were, willing to give it a try. Especially because they had found, in the very beginning, they had found a mass that was very close to the brain, and mebendazole was showing activity against anything that has, that is like tumors in the brain. And so she started that. Of course, we were doing like the minimum dose, but even just 3 months later, they couldn't find that tumor, right? And so, I don't know, it's chemo, the mebendazole, but I just feel like the fact that we were attacking this from every and all angles, it makes such a huge difference. Yeah. So, for that, we were able to see some, drastic changes. So it all just, it was fabulous. It works. And of course, I think for some of that in metformin, which is really good for reducing the blood sugar in the system, which, cancer loves sugar, right? And so it just everything, Denshin, which is like a protein, it protects, a protein. But yeah, I would say that says, let's say Denshin. Yeah. It's kind of like a Lipitor. Natural Lipitor that helps, but it shows activity against cancer as well, which is interesting. You stand like the kind of the style you could use. Yeah. Okay. We did touch on it a little bit. We'll go back a little. So we touched on your experience with Ants for Cancer. Yeah. How would you, describe that specific experience and what it meant? Yeah, so Answer for Cancer was amazing. Actually, at some point, when Mom was talking to me about all this oxygen stuff, it's very expensive, and we're already traveling to MD Anderson to Texas like every month, and things are adding up financially, and it was a hard season. And so Answer for Cancer it was literally an answer to a prayer, because we were like, how do we start all these things that she's really looking forward to doing, like the oxygen treatment and infrared and even therapy, and juices, some juices they do as well. And they were able to sponsor Mom for like a whole year, with treatments that she could do every month, and just phenomenal organization and how much they helped her, when we didn't have all the resources financially for everything that we were trying to do. But they were just amazing. The support, Misty texting me and saying, hey, how's Mama doing? And there's other things she can do. And just, it was 1 year where Mom, we saw her improve so drastically, and it's like, where you can point the finger, but we just know the support was just phenomenal. Yeah, nothing like it. So, I kind of started off the interview, but I don't think with the assumption that Mom has breast cancer, but actually, speak to the type of cancer she has, and what's been the progression since the initial diagnosis. Yeah, so when we first found out, we're told that it was stage 4. It was extremely scary, and that it had spread some to the whole approach. We on our which type, or just where it had okay, yeah. So it was the stage 4, but then it was the HER2 positive, ER negative, right? Estrogen receptor, positive or negative? No, negative. Okay, sorry. Yeah, and it's it was, they have treatments for this, where if you're able to get really targeted chemo, actually oral pills. That she started on, thank goodness, instead of IV options. We had been told it had spread. At some point, even she was struggling to breathe in the very beginning of it all. And that was just scary in and of itself. And so once we started treatment, including everything that we were doing that was alternative, just within a month, she was able to get off of her renal treatment. And then about 3 or 4 months in, as they're doing the scans, the PET scan and the MRIs, they were showing that the tumors are shrinking significantly. And that continued on for the rest of the year, where they're saying, to where there's actually the disease is very stable. Most of the one that was spreading to the bones is not there. Thank goodness the one on the brain is not there. So yes, it's been used to death. Grateful, left, right, and center, because it's not always like cancer, moves in the opposite direction, especially when it's so advanced. So yeah. It is one of those things that affects the entire family, not just the person who's dealing with the disease. How do you think you guys were holding up during that time? So we're a prayerful family, so there was a lot of prayer. But Mom is also funny, man. She is like, we're not gonna be mopping around. This is not anything sad. Like God got us, and we're like just keep on keeping on. And she would wake up and she'd cook breakfast for the kids. I don't know with what energy. And she, still to this day is the one who makes dinner sometimes. And she's like, we're gonna put on some movies and we're gonna laugh, and and she still plays with her grandkids. So I think just being surrounded by her babies might hurt me and her grandkids, which is like her favorite things. But just having family support and and a really beautiful attitude. Like Mama is just beautiful spirit and has nothing really gets her down. She's like, we got this, and she means that. So yeah.
Okay, so we'll kind of end with like, what advice would you give? I'll ask Mom if she can answer. What advice would you give someone who is going through this experience or may have found a long-term age infection?
First of all, thank you to you, Dr. Awesome. I call her Dr. Awesome.
Yeah.
You are
This.
you are awesome. Yeah, you helped me when I was weak. God bless you. I'm going to advise people who have cancer to stay strong and to ask us to do everything it takes. It's a disease that is found a disease, metabolic disease. So watch your diet, watch your everything, even be fearful. Spiritual therapy.
Yes.
The spiritual therapy is good for you, and take natural foods. Spinach and natural life food.
Snack.
Yeah. And stay on course. Yeah. If you are serious about treating your cancer, you succeed.
Yes.
Because the doctors are there to tell you other things that they can help you, but you help yourself. Yeah. That's all.
That's great. A great message. And
Susan, what would you ask? Yes. So just the advice I would give is just, we love our doctors, but I would also tell you to, do your research, like especially when it comes to alternative, because you do want to attack it from every angle. Like Mom said, it's metabolic, it's always emotional, and then spiritual, and it's all these things that you can combat with. And I would also say, find doctors that have open mind and care. Like
Dr. Awesome.
Yes, the level of care is bar none. It is so rare. And so just the fact that we can reach her anytime, the way that she's cared for Mom, and it's so much more. It's such a rich experience, being that she's the one that takes care of us, and so I would say, get you a really good doctor who cares so deeply about you, and that you're just not another patient. And it changes everything. It really does.
You have another part less support system.
Yeah.
100% really necessary.
Yeah.
Well, thank you both for spending the Saturday with me. I appreciate it. And so that will conclude our interview. I thank you very much. Thank you.
Thank you.
And so coming from
I know, right?
dragging mommy at the house.
On a Saturday. Hey, it's Dr. Isom. Thanks for watching this video. If you enjoyed this one, there are more to come. So don't forget to follow us and share.